Hello, everyone, and welcome to our presentation about telerobotic ultrasound by Abby, Palvi, and Simon. Some of the things we will be going over during this presentation are: what exactly is telerobotic ultrasound? For simplicity, we will just call it TUS. How and where can this technology be useful? In what settings can it be useful for? And we will look at future research with this technology as well as some of the challenges that come along with it. So how does TUS relate to regular ultrasound? Well, ultrasound, as we know, is a widely utilized form of medical imaging that's highly favorable due to its convenience, non-invasive nature, and fairly quick imaging techniques, and its portability. Quick and convenient access to ultrasound services can contribute to early diagnoses of various medical conditions and can allow for regular follow-ups for these conditions. The main problem is access to these ultrasound services, however, remains limited in remote and rural areas, contributing to negative patient outcomes. So, TUS is an innovative technology that offers a solution to this challenge of limited accessibility by allowing exams to be performed remotely. In addition to remote access, TUS offers solutions to other challenges seen with regular ultrasound. The topics that we'll be focusing on in particular are its uses in remote settings, its role in imaging radioactive or infectious patients, and its aim to mitigate the impact of healthcare professional shortage, particularly radiologists. Although TUS offers solutions to these various limitations with regular ultrasound, there are still some challenges with this technology. Some of the challenges that we will cover are expenses with the technology, human factors such as human interaction, and the legal aspects.
Telerobotic ultrasound has three components: a console, a patient-side manipulator, and a software control system. The console, as shown here, contains a screen showing live video of the patient and the robotic arm. It also has a monitor screen like the one we see on an ultrasound machine. There's an operation pad where the sonographer scans with a probe, along with a control panel that's similar to the ones on the ultrasound machines. The patient-side manipulator involves the ultrasound device, the ultrasound probe, and the robotic arm that controls the probe. Finally, the software control system communicates the movement made on the operation pad by the sonographer to the remote ultrasound device to perform the movement.
Now that we are familiar with how TUS works, let's talk about how and where TUS can be useful. Some patients living in remote communities have to spend time and money to travel for their ultrasound exam. For those who cannot afford to travel for their exam, they may end up not making their appointment, which leads to an impact in their care. TUS makes ultrasound exams accessible for these patients. Out of 87 TUSs done in a remote community, 70% of them were sufficient for diagnosis. 95% of the patients who had a TUS exam done were open to having another TUS exam done in the future. Not only is TUS able to address accessibility to rural and remote communities, but it can also address the gap of early assessment in patients who are suspected to be or are infectious. These patients are already facing limitations on whether and where they can go to address their healthcare needs. With the help of TUS, those patients can address their clinical questions without placing other healthcare workers in a risky situation. Sonographers in one city in China were able to use TUS to assess COVID-19 positive patients in another city, helping with diagnosing patients early enough and allowing for repeated assessments if needed. Along with infectious patients, TUS is seen as beneficial for nuclear medicine patients, as they are radioactive and could cause negative effects to those exposed. With the help of TUS, one study showed that it is feasible in diagnosing radioactive patients, as they are able to address their healthcare needs without facing any restrictions, and they aren't exposing sonographers along with other healthcare workers to radioactivity. Not only can TUS help with the shortage of sonographers in rural communities, but it can also help with the shortage of radiologists. In order for TUS to be successful, the role of the radiologist is key, as they are the ones reading these images and determining if they are diagnostic. The shortage of radiologists has been an ongoing problem throughout the years, as there seems to be a decrease in those interested in radiology. With this, the growing need for imaging services and an aging population is making matters worse. Radiologists who read the TUS exams done in rural communities are far away from the site of the exam. This highlights how TUS can help provide full access to imaging and a diagnosis in rural communities, addressing the radiologist shortages.
Next, we're going to talk about future research and challenges. Future research should include patients' and professionals' acceptance of telerobotic ultrasound and how the advancement of artificial intelligence can aid telerobotic ultrasound. A small study was done on the acceptance of telerobotic ultrasound in children aged 1 to 10 and found that of the 76 patients, only one child was frightened by the robotic arm. More research is recommended on the acceptance of telerobotic ultrasound in a wider variety of patients, as well as the professionals that are going to be using the equipment. A study looked at how AI can be used with telerobotic ultrasound, as it can be used to enhance navigation or possibly provide a diagnosis on the acquired images. As AI continues to evolve, future research is recommended on how it can aid in telerobotic ultrasound. Some challenges with telerobotic ultrasound include expenses to build and maintain the equipment, human factors, and legal issues. Telerobotic ultrasound decreases interaction between healthcare workers and patients. This could impact how patients feel about healthcare. It removes the human connection and support that the patient usually gets during an ultrasound exam. Some legal issues include the transmission of patient information over networks. This could compromise the protection of the patient's privacy.
Thank you so much for listening to our presentation. Let us know if you have any thoughts on telerobotic ultrasound, if you think it's beneficial for future use as sonographers, and let us know if you have any questions. Thanks.